Can you tell me what myofascial trigger points are?
Your eyebrow ring.
Tell me what a myofascial trigger point is.
No. I have no idea.
Is that like the pressure points on your head? So like here, maybe, and here, maybe.
I have no idea. Points that you can, points on your face because they're facial that make your face react in certain remarkable ways.
So, what exactly are myofascial trigger points? Well, the definition of myofascial says that it is fibrous tissue that encloses and separates layers of muscle. So a trigger point is basically a small, tight muscle spasm in any part of muscle in your body. Trigger points often cause other types of aches and pains that are often misdiagnosed as serious conditions, such as arthritis or disc problems. Often these conditions aren't present, but if they are, trigger points may also be adding to the pain that you're having. Referred pain also comes from trigger points, so you can have a knot or pain in your abdomen and you wouldn't know it because the pain would be going all the way down your leg and you might think you have a quad problem or you pulled something, but really it's a trigger point. It's also the reason for a lot of strange headaches. You could have trigger points in your neck and have headaches in the back of your head or up and around your eyebrow in those strange spaces, or anywhere in the crown or down into your chin. So what causes these points? Well, anything can. Stationary jobs often do, repetitive jobs often do. You can get a trigger point from lifting heavy objects or just being pregnant, but most often it is from overuse injuries from repetitive sports like rowing, biking, running, and swimming. See, here you have somebody that is erging the correct way. If you correctly perform your sport, you are less likely to have trigger points in your body. But if you do it incorrectly, like she is now on the erg, you can have problems with trigger points because of the incorrect posture. Any sport you do that deals with repetitive, constant motion has a possibility of causing trigger points to show up in the overuse area. This is why it's important to know proper technique in such sports. For example, if you're a swimmer, you want to make sure you aren't performing your stroke incorrectly. Good technique in such a sport is key to avoiding the development of trigger points. So, how do we prevent these trigger points from developing? Well, there are a few ways to do so. One technique you can use is stretching. Now, it won't always prevent trigger points from occurring, but if you do it often enough in the right areas, the muscles will loosen and be less likely to create said points. Another good technique to use is using a foam roller. Foam rollers can be helpful in preventing and treating trigger points. To use the foam roller, you find the spot that's bothering you, apply pressure with the foam roller, and roll back and forth onto it. So, how do we treat these trigger points? How do we make them go away or better? A common practice is massage therapy. What a masseuse will do is find the trigger point by feeling around in the body, and when it finds it, they will apply pressure and massage it out in a deep tissue type massage. Acupuncture is also sometimes used, but it is not as common as massage therapy. A more drastic version to get rid of trigger points is needling, dry needling, or using other ingredients such as saline. But some people do not respond well to saline. Still, dry needling causes more soreness afterwards. So, when it comes to trigger points in sports, it's always important to remember good technique. Trigger points are still often unavoidable no matter what, so when you think you may have one, or if you have an ache and pain that you don't recognize to be anything else, you can talk to a massage therapist or your trainer to see what your best options are for treating it, because they are treatable and easy to get rid of if you know what you're looking at.
you.